Hi, I'm Dr. Stacy Fisher. I'm a cardiologist, past president of the Regional American Heart Association for Maryland. Welcome today to the Red Chair Series. I'm so glad you could join us, and I'm so excited that you joined us as part of the American Heart Board as well.
So nice to meet you. I'm Yvonne Commodore-Mensah. I'm an assistant professor at Johns Hopkins Schools of Nursing and Public Health. I'm a cardiovascular disease epidemiologist, but I'm also a nurse by training.
How did you get interested in cardiovascular disease and even just in medicine?
So I was born in Ghana and came to the US in 2004 for college. So first of all, imagine the culture shock.
Yes.
But what that did for me was to help me to understand the immigrant experience. So when immigrants arrive in the US, they experience a number of changes in terms of changes in diet, physical activity levels. So if you're used to a specific type of diet and you arrive in the US and suddenly you don't have access to those same foods, you may make other unhealthier choices. If it's more expensive to buy healthier foods, you may opt for fast food. And we know that that's linked to poor heart health. And if, for instance, you arrive in the US and you only had access to healthcare in your native country only when you were really sick or there was an emergency, and you don't understand the importance of preventative care, right? Seeing your doctor every year. You may go years without ever seeing a provider, right?
Wow.
And so these are some of the core messages that I stress when I engage with people in the community, that it's important to work hard. I know so many people who work at least 2 jobs, but as you work hard, it's important to work harder to take care of your heart and yourself, making healthier lifestyle choices, and also taking medicines as prescribed if they are prescribed by a provider.
There's also a trust issue with, can we trust our providers? Do we have a relationship? Can we have a frank discussion? Will they know who I am? Will they listen to what I'm saying? And I think that is part of this social determinants of health, and really part of trying to get care to people and allow them to accept care so they can be healthier. How does that go into the research that you're doing?
I think you hit the nail on the head, which is trust. There are a lot of people who engage with the healthcare system and may not necessarily trust their providers because of some preconceived notions or just discomfort with the healthcare system, right? And so we have to acknowledge that sometimes we may have to go a step further to elicit or understand some of the barriers that people are facing. And there's a concept we describe in healthcare in terms of patient-centered communication, right?
Yeah.
We may have to go a step further to really understand what people think causes their condition, any socioeconomic challenges, assessing social determinants of health. If someone does not have enough money to put food on the table and you're talking to them about taking their medicines, you've lost them, right? So really getting to the heart of understanding people's lived experiences, and then going ahead to have that conversation about, are you taking your medicines as prescribed? We need to acknowledge the social circumstances that a lot of our patients deal with.
And some people have come back and said, you know, what I'm afraid of is judgment. And that in my presentation with somebody, you know, I don't want to say that I couldn't afford that medication, so I just didn't get it, and I didn't tell you I didn't get it. It's really important that that's part of the conversation and the way that training is done too. What message would you give to somebody interested in a career in medicine, especially a young woman?
I would say go for it. Find someone who inspires you, connect with them, ask them to share what their journey's been like. And most people will be honest with you. It's not all rosy, but it's definitely worth it. I found it to be very fulfilling. Never in a million years did I really imagine that I would have the opportunity to design research studies to promote cardiovascular health in diverse populations, right? So I really get to do what speaks to my passions in terms of helping underserved communities and people of color to live longer, healthier lives.
It's been so much fun to meet you and have you here today, and so much fun to work with you at the American Heart Association.
Thank you so much for having me. I've enjoyed our time together.